Hey guys, I'm Chelsea with the myCNAjobs Recruitment Squad. Today we're going to be offering some tips about how to build good relationships with your patients. The first tip we have is to make sure as soon as you meet your patient, introduce yourself and don't be afraid to tell them a little bit about you to make them feel more comfortable. Our next tip is to make sure you always are both honest and transparent with your patient. They're not necessarily sure about what's going on and might be confused, and it's important that they feel comfortable around you, and you can make them feel more comfortable by being honest and being transparent. Our next tip is to not be afraid to communicate with their loved ones if it's allowed within your agency. If it's just the agency communicating with the family, that's fine, it's not in your hands. But if you do have the opportunity to interact with them, don't be afraid to communicate and mention any problems or situations that may have arisen. Our next tip is to make sure that you follow the care plan for the patient. Because the care plan is designed by a supervising doctor or nurse, it ensures that the patient is getting the best care they can, and it's important that you follow that plan. Our last tip is to make sure you're always listening to the patient or your client. Because you're around them constantly, you might be the first person to hear about possibly a new symptom or some new ailment that they have, and it's important that you listen to these problems and then you communicate them to your supervisor or their doctor. For more information on communicating with patients or for caregiver job tips, check out myCNAjobs.com. Later guys, and good luck.